So as we think about how we raise our standard of care, and more importantly, how we get the awareness out there about these standards of care, we have to think about how we engage our patients day to day who might not yet be a candidate for an interventional process, TMS, Spravato, ketamine, but who statistically may end up there. And that includes engaging the patient earlier in the process so that they have their own autonomy to make the appropriate decisions around the data that we know to be true. Even though TMS and Spravato are often approved by insurances at step edit number 3 or number 4, the reality is the APA, our governing body, actually slots in TMS as treatment option number 2. So if you have tried and failed Prozac, Zoloft, Lexapro, Effexor, Wellbutrin, and by the way, failed could include not being able to tolerate those, the APA says you actually are, it's just as safe and just as likely to be effective to go right to TMS at that point. So although most insurances may not cover before you've at least tried 2 or more medications, it doesn't mean we shouldn't start having the conversation with you as a patient or with a patient as a provider so that they understand what options they have. As we think about informed consent with a medication, you also should be informing the patient of what their treatment options include, and that must include the idea of things like TMS, Spravato, and ketamine, and frankly, in the near future, psychedelics like MDMA and psilocybin.